doctors and nurses of Reddit, what is the dumbest health tips you've heard people give out? Story 1, paramedic and CPR instructor here. I was teaching CPR to a room full of cops, and we were talking about AED use. After I finished the LT, comes to the front and explains to his officers that each police-issued taser can be used in place of an AED by a shocking directly over the heart. I was dumbfounded. I quickly told everyone that was not true, and the act could get them in a lot of trouble. The LT was visibly mad that I corrected him in front of everyone, and he ended up calling my supervisor. Edit, hey guys, thanks for all the replies. I figure I should clear some things up. I did instruct the class that this was not appropriate conduct. Honestly, most of them already knew that their LT was spouting BS. The PD and FD in my area, like most, take CPR AD every year, even though their AHA license is good for 2 years. Most of these guys are very smart and learn well. I went on to explain that the only shockable heart rhythms you can be in are ventricular tachycardia and ventricular fibrillation. Both require just the right amount of electricity to restart the heart. The wrong dose of electricity can stop the heart, which is even worse than VT and VF. The LT had been implying that if no AED was available or coming soon, he would with good intent shock the patient's chest with his taser. I told him he no longer can say good intent because now he knows the medical truth. Story 2, anytime someone tries to predict their outcome based on some relationship. Doctor, sir, you had a heart attack, you aren't out of the woods yet, and we need to talk about some serious lifestyle changes going forward. Patient DR. My wife's mother's cousin had like 4 heart attacks and lived to be 99 years old, and he smoked and ate bacon and eggs twice a day until he died. He'll be fine. In that same vein, when a doctor makes a recommendation for treatment or surgery, and the person whips out WebMD and tries to one-up the doctor. Story 3, I was interning at a hospital and observing a pap smear of a 16-year-old girl when the doctor said she had a yeast infection. The mother, who was in the room at the time, told the girl to just soak in bleach. When the doctor explained to the mother why this was bad, she refused to listen and got super upset. So we left them and went to lunch. People, paramedic here, this isn't really a health tip I've heard, but rather witnessed if I respond to a seizure call or an unresponsive party, about 1 in 10 will have a bag of frozen vegetables in their pants. For some reason, the people in the city I serve think frozen vegetables will fix anything. Story 4, pharmacy tech here, really grinds my gears when I hear people recommending to friends to switch to gluten-free. Good Lord, woman, yes, it's always women. If you were intolerant of gluten, you would be shitting from holes you didn't know you had. Story 5, not so much advice, but I had a patient who was having an asthma attack. We arrived at her house, and she was smoking a cigarette. I try not to be to people, but I explained to her that next time she's having an asthma attack, smoking might not be the best idea. Her response was incredible. Nah, it's all good. I switched to menthol. Story 6, nurse here. Any and everything relating to Dr. Oz. I go into fits of rage the second he's mentioned, unless you're getting advice from him on cardiothoracic surgery. Also, people thinking you need to hold someone down who's having a seizure so they don't get hurt. That's how we break bones. Just move furniture and whatnot out of the way and call appropriate help. Grabbing the arms and legs of a thrashing person is bad juju. Story 7, medical malpractice defense attorney here. I read through all the records and depositions of plaintiffs' patients and doctors, nurses, defendants. One plaintiff in sworn deposition testimony said that a doctor told him to alleviate constipation by eating cheeseburgers. No, that does not work. The doctor apparently broke out laughing when he learned of this testimony. Plaintiffs, and to an admittedly much lesser extent, caregivers make up all the time to win cases. Not a main issue of the case, but funny made-up medical advice anyway. If you're having trouble pooing, eat all food groups but vegetables and fruits. Story 8, school nurse here. So, people automatically assume I'm an idiot. I had someone tell me that insulin makes their sugar go up. It's just like that in some people. I've also been told that it's best to keep drinking diet sodas because stopping abruptly can make you very sick. My doctor told me I need to drink Diet Cokes or I may end up in the hospital. And don't get me started on the best treatments for lice. By the way, don't put gasoline on child's hair. Story 9, tilt your head back with a bleeding nose. This is stupid because instead of having the blood run out, OHNO, your closed floor will be so covered it'll be uncleanable, or throw up and have blood go down your throat. This doesn't mean hang upside down with your nose pointed to the ground. Just forward a bit. Story 10, not necessarily a tip that's given out, but rather ignorance, misinformation. Out of med school, I worked at a women's clinic in an inner city area. Very often someone would be treated for an STD and contract the STD again because their partner was not treated. Oftentimes the reasoning was that the antibiotics gave me immunity to the STD. This is exactly why enhanced and accurate education is so crucial, especially in areas with high STD and teen pregnancy rates. Similarly, Natural remedies that involve sticking a garlic, clove, parsley, cilantro into the vagina are guaranteed to end in disaster. Story 11. A patient's brother came in to visit after his bro had a seizure. He said to me, "So I was reading about seizures online. Next time I see my brother having a seizure, they'll put a spoon in my brother's mouth and hold his head still." My response, absolutely not. Do not stick anything in his mouth, and do not hold his head unless you want to break his neck. Get him a pillow and set it under his head, and move objects out of the way so he won't hurt himself. Scary. Story 12. I got an ex whose parents believe that a trip to the chiropractor will fix everything. Sinus infection, chiro. Yeast infection, chiro. Depression, chiro. Pneumonia, chiro. Diabetes, chiro. Asthma flare-ups, chiro. Iron deficiency, chiro. Stomach flu, chiro. Ear infection, chiro. Going to the doctor, nothing. Can't trust them. Story 13. Not a nurse, but had to add this. My aunt just tried to tell me that taping a cut onion to the bottom of your foot will cleanse your blood of toxins. Story 14. The parents of a child with cerebral palsy who told me they stopped her anti-seizure medications, but they justified that it was okay because they were giving her lots of Monavie. Story 15. This is probably too late to be seen, but we had some volunteers that were leading a diabetes education class for low-income, uninsured patients at a free clinic. The volunteers were not health professionals, but were given worksheets and a clear list of talking points. They were also told that if they didn't know the answer to a question, they should have the patient submit it via email, where one of the volunteer nurses or physicians would answer it. The worksheet basically walked them through diet and exercise advice, how to measure blood sugar levels appropriately during the day, what kind of follow-up care podiatrist, ophthalmologist, etc. is important, what symptoms of worsening disease to watch for, that kind of thing. Anyway, 2 months ago, one of the nurses had some free time and was able to sit in on one of these sessions. The volunteer, who had been there for a little over a year at this point, was telling type 2 diabetics to go on juice cleanses. This bears repeating. A volunteer at a free clinic, who is going to come across as a health expert to these patients who generally have low health literacy, is telling glucose-intolerant individuals to eat nothing but sugar as a diet strategy. The nurse asked her for a quick word outside, and then told her she wouldn't be leading those sessions anymore. Story 16. A lot of older women who were in their heyday during the 50s and 60s swear by douching with cleaning liquids such as Hexal and Lysol. No amount of warnings, yeast infections, research, or logic will make them change their minds either. Story 17. People who offer to share antibiotics with their friends. You shouldn't really have any after your course of treatment. Be they expire, yours may not work for what someone else has. Story 18. Nursing student here. I once heard a nurse from the Philippines say that this patient who had a stroke should be eating as much leafy greens as possible when they get home. The reason why this is stupid is because we give people who have strokes Coumadin and warfarin for treatment at home, because it's easier than injecting themselves daily. Vitamin K, found very commonly in leafy greens, is the direct antidote for this medication. Promotes blood clotting, leading to another stroke. Let's just say that when the MRP found out this nurse was in deep. Story 19. I had a woman come into the ER with very heavy postpartum bleeding. As I was setting up in 4 for normal saline, so freaked, asking if it would affect her breast milk. I assured her it wouldn't, and she then asked if the 4-pole could go outside. When I asked why she was asking, she said she needed to go out for a smoke. Story 20. Vet hospital worker here. I hate when people say they give their dog garlic as flea and tick prevention. Not only does it not work, it's toxic, it can cause anemia. Also, dark beer does not prevent fleas or ticks. And just because your pet doesn't go outside doesn't mean they're immune to heartworms. Mosquitoes get inside the house, too. Story 21. I had a mother put coffee grounds in her son's scalp laceration. She said it helped stop the bleeding. It took some effort to scrub out the coffee so we could suture the wound. Story 22. I'm not in the health field, but my BFF has a degree in nutrition. She was telling me that one of her friends told her that if you drank water when you're scared, you'll get diabetes. Story 23. Pediatric nurse here. Wrapping someone with a high fever up to let them sweat it out is not a good idea. Warming something that is too warm does not make it cooler. Rapid escalation in body temperature can lead to convulsions, especially in children. Story 24. Not a doctor or a nurse, but paramedic. Each month, I get a pregnant woman who has the worst case of indigestion and diarrhea of their life. Why? Someone told them to drink castor oil and eat spicy foods to bring on labor. In all reality, it just makes your brains out and your feels like an inferno due to the spicy foods. The Bayer commercials kill me. The ones that say take an aspirin, save yourself from a heart attack. No, just no, an aspirin alone will not save you. In conjunction with a CBG stent placement, strong antiplatelets, and other fun drugs, aspirin helps. It is not the magic pill of life. Story 25. I'm not a med professional, but while I was living in Ecuador, the lady I was living with made me wear a potato necklace like sliced, raw potatoes helped up to my neck with a towel tied in the back to out the infection from my throat. I had a very slight cold, just a tiny scratchy throat. Really, I didn't know enough Spanish at the time to understand her logic, and so I went with it. People are strange. Story 26, as a registered dietitian in a hospital. I'd say a solid 90 of my job entails hearing people's bullshit, so eating a tablespoon or so of cinnamon each day is going to control your blood sugar. No need to follow a meal plan or take your meds, Dar. Oz says that turmeric, cumin, whatever random spice will speed up your metabolism, so you don't need to change any of your habits to lose weight. Outstanding. Story 27, I was told to roll up a piece of paper into a funnel, and then put the smaller end in my ear and light the larger end on fire to remove water from my ear. Story 28, not a nurse yet. Working my way through nursing school, but I used to work with a guy who would always say I drink nothing but Red Bulls and Coke and smoke 2 packs a day. But that's okay, because if your blood pressure is 0, that means you're dead. So I'm trying to keep my blood pressure as far away from 0 as possible, so I won't die. Story 29, this won't be seen, but I really liked it. I used to be a paramedic when my team got to a car crash victim with a broken leg. Witnesses were very busy bringing him a glass of milk from a nearby restaurant, because milk is so good for your bones. Story 30, paramedic here. Once heard a man suggest to his friend with third-degree burns that he should put toothpaste on the burned area because the mint will help cool it and then you can scrub it off. Story 31, put a spoon or your finger in a person's mouth if they start seizing or else they swallow their tongue. How stupid do you have to be to think of something like that? Knew a guy who tried the finger thing, and yeah, that didn't end well. Also, you can't swallow your tongue. It could just fall back and block the airway if you're limp. Story 32, according to my future mother-in-law, taping onions to the bottom of your feet will cure you of any illness, because onions can magically remove toxins from your body through your meridians. WTF. Story 33, if you call an ambulance to take you to the hospital for your ankle pain, finger laceration, chronic back pain, etc., you won't have to wait in the waiting room. Story 34, Eve had patients try to tell me vaccines are a waste, and there are no studies to show they do anything. I don't treat them anymore. I'm a massage therapist. Story 35, I've had a family member tell their elderly parent to refuse the flu vaccine because KT causes the flu, then proceed to argue with me and tell me that I don't know what I'm talking about when I said you couldn't get the flu via the vaccine. Story 36, I had a patient ask if swallowing Vicks VapoRub would help his chest congestion. No. However, it might give you some kind of chemical burn down the entire length of your esophagus. Story 37, don't eat gluten. Only people with celiac disease get a benefit from this. Don't give your kids vaccines. They'll get autism. Moron Jenny McCarthy, who also sells e-cigarettes. My favorite ever was a guy who gave another guy some sort of lip balm and told him, take this, man. It's HIV repellent. Don't even need a condom. That was very dumb dental hygienist here. One of my patient's friends told him it was dangerous to get your teeth cleaned more than every 4 years or so. He had a quite heavy case of periodontitis. He's pretty young as well. Story 38, not a medic, but I feel compelled to kick people in the teeth when they refuse to go to the doctor or take a sick, injured family member to get much-needed medical assistance, because the Lord will heal them. Story 39, nurses aid in an ER here posting for a doctor with 35 years experience. He says one of the dumbest things he's heard was to help avoid poison ivy, you should eat some of the leaves. Story 40, a guy I used to work with told my friend whose dad had cancer that he's an idiot for getting chemo. If he had eaten avocado seeds, his cancer would have been cured. I read about it on this website. I try to explain that not everything on the internet is true, and he should not take medical advice from the internet. His response, haha, you're so funny. I've done research. Almost hit him with a shovel. Story 41, cutting yourself to let the evil out. Bathing in ice, carrying nice, smelling flowers, live in a sewer, smearing yourself with human, rub a chicken alive on you, and, unfortunately, kill Jewish people, all supposed cures for the bubonic plague. Story 42, that babies should only listen to classical lullabies. People who say this will cite the Mozart effect. In regards to learning, there is no empirical evidence to back this claim, and if you investigate, you'll find that there's very little support outside of vendors for classical music. Story 43, taking Tylenol PM to go to sleep. This lady was telling an old guy to take that, and a glass of wine to go to sleep. Tylenol itself is great if you have pains. It goes to that side in your body and relieves the pain. If you don't have pain, the acetaminophen cycles through the bloodstream and then goes to your liver, where with your liver cells. Worse if you have alcohol in your system. Tylenol PM is simply acetaminophen 325 milligrams and Benadryl diphenhydramine 25 milligrams in a capsule. If you really want to go to sleep, just take Benadryl and save your liver. Story 44, not a doctor or a nurse, but I burn my arms, hands while baking frequently, and a friend told me that I should run hot water over the burn because the sudden change in temperature using cold water would do something, I guess. Story 45, I'm just going to say homeopathy, heavily diluted substances, and what they exactly focus on. When I was younger, was constantly dragged to a homeopathic doctor who gave me the same things for Crohn's, Lyme's, the symptoms from a subdural hematoma, and TBI, depression, and anger. Are they gastroenterologists, neurologists, or psychologists? One extremely diluted substance would cure my TBI. She also said fish oil would help my depression, when omega-3 is for preventing heart attacks and strokes. God damn it, that whole thing is bullshit. Story 46, my buddy would always ask my fiancée, who is a RN, medical questions. One day he stated that after having, he would dip his in Listerine because it kills 99 of germs. He legit thought that Listerine would fight STDs. 99, 9 of them. Story 47, there are some churches, usually Pentecostal in Africa, who don't believe HIV exists. Many recommend not taking any medications and instead drinking bleach. I have had a few patients who have followed this advice. It's frustrating as they don't engage with any outpatient care, so usually see them when they're hospitalized again and again with progressing HIV-related illnesses. Added another thing I thought of, back in the 90s, I would often do HIV education sessions in schools. Where possible, I would take someone with HIV to share their story. I used a new woman once when my usual trusted speakers were not available. I had known her a while. She had been an IDU and street working prostitute for years, and her husband had died of HIV. Basically very clear high-risk behaviors. No surprises there. She is speaking to the kids and proceeds to tell them about her past life. Then says she acquired HIV when her husband was dying because he grabbed her arm and bit her. She tried to elaborate on this, but I quickly intervened and corrected this. Needless to say, I removed her from my speakers list. Story 48, microbiologist here. I love when people go to the doctors and demand antibiotics for a viral cold. Not only will it do exactly jack to help you feel better, but it increases resistance, Story 49, a chiropractic doctor told me that the natural extracts he sells at his office work because the atoms in them spin clockwise instead of counterclockwise like non-organic atoms. This was in a health lecture with about 30 people. I was the only one having a problem with this, and everyone else was looking like I was the idiot. But think about it, ignore Brownian motion for a sec. Suppose the molecules were spinning clockwise from your point of view as you look down on a bottle of this stuff. Now, keep watching, but look at that bottle from the bottom. Now, it is counterclockwise from your point of view, or just flip the bottle upside down. Now it's counterclockwise. I try to gently explain Brownian motion. I try to suggest that maybe he has confused this with electron spin, not related to QuackMed, but at least that is a thing. I tried to flip the bottle argument above. I disclosed my chemical engineering degree. His crowd accepted answer. He saw a GIF about it on PowerPoint at Palmer College of Chiropractic. Scary, not just this one guy's nuts idea. It is taught science at this school. I gave up my faith in the intelligence of my townspeople on that day. They were all eating this up. Story 50, my mother is a nurse, and she says there are people that still think smoking is good for people with asthma because it makes them cough and therefore clears their throat. She says that she gets a lot of new age-type people saying that some obscure South American country has an all-natural cure for cancer that is supposed to be cheap, and the only reason we don't have it here in developed countries is because big pharmacies don't want to lose their customers. This really infuriates us because we have family members that are currently fighting cancer. Story 51, not so much health tip, but I cannot stand when 1, people come into my ER high on whatever complaining about the side effects of said drug. 2, people tell me how fast to push a medication. God damn it. If you tell me how to do my job, then it's time for you to GTFO. Story 52, nurse here. I was caring for a 70-something-year-old lady who, for various reasons, had ended up incredibly unwell and in ICU before being transferred to my ward once well enough. She was a very large lady who was definitely stuck in a victim mindset and who had very little motivation to help herself. The real issue was her daughter, who was her primary carer. She visited above and beyond the visiting hours and got annoyed if we had to send her from the room to attend to patient care. A general pain in the one day she was complaining bitterly because her mother's meal tray had come with apple juice. My mother would never order apple juice. She knows not to drink apple juice. My dietitian told me it is far too high in sugar we never have in the house. Blah, blah, blah. The daughter was also the size of a house and brought her mother soft drinks, chocolate, and chips constantly. Talk about not living by your own advice. It is people like that that make me hate caring for the public at times. Story 53, I worked at Radio Shack, and a woman came in to buy some wire, a 9-volt battery, and the connector for the 9-volt battery. Since that isn't enough to actually build anything, I asked her what she was fixing. It was her cancer. She was going to pass current through a coil of wire that was inside a cup of water, then drink the water, and that would cure her cancer through the power of bullshit, I guess. I told her to please get real medical help, but I don't know how effective I was. After all, I'm just the idiot at Radio Shack, and she clearly knew much more than me about cancer and electricity. I never saw her again, so who knows what happened. Story 54, pediatric nurse here. Wrapping someone with a high fever up to let them sweat it out is not a good idea. Warming something that is too warm does not make it cooler. Rapid escalation in body temperature can lead to convulsions, especially in children. Story 55, anything involving homeopathy or raw food diets to treat lethal diseases. 1,000,000 times more when it involves children. Eating raw kelp is not going to cure your child's cancer, you stupid. Story 56, energy medicine. I was so pissed off when I found out that multiple universities actually teach courses on energy medicine. It's surprising how these schools in the West are not respecting evidence-based medicine at an increasing rate. Story 57, nurse here. I have heard many times that the effect from quitting smoking are actually worse than continuing to smoke. Patients tell me their doctors tell them this. Story 58, my grandma believes that if you sleep near a bar of soap, it will heal joint pain. The soap isn't under her joint or in her bed. It's in a plastic bag on her nightstand. Does wonders for her knees. Story 59, EMT here. Yesterday, I was at a car wreck where the patient had a compound tib-fib brake shin bone was broken, sticking out. I heard a bystander loudly say, "Why don't they push the bone back in his leg?" No. Story 60, my co-worker, who was once a nurse, told me that on my period could give my boyfriend AIDS because she thinks blood, automatic manifestation of the AIDS virus. Story 61, I once worked with a country girl who was going for a romantic weekend with her boyfriend. She didn't want her period to start till after she returned, so she was drinking a mixture of flour and water to stop it. I told her she was going to end up making gravy instead. Story 62, my mom is a pharmacy tech. Many years ago, she was listening to 2 women chatting, one of which who had come in for anti-malarials. Woman 1, I don't know why you're bothering with these tablets. Woman 2, well, I don't fancy malaria when I go to Africa, so... Woman 1, yeah, but I went last year. I didn't get malaria. It's just to get money from you, woman 2. So you didn't catch malaria even though you didn't take the tablets. Woman 1, oh no, I took the tablets but didn't get it. What a con. People like this are amazing. Story 63, not a doctor, but the flu is going around. Better stock up on Germ-X, or I have a cold. Better use some Germ-X. Germ-X is an antibacterial. Colds and influenza are viruses. Germ-X does nothing but creates strong mother bacteria. Story 64, diabetic urban myth. Someone confirmed I once heard from an EMT paramedic that if you have a diabetic go into shock, it's best to put a small candy or something sweet in their mouth, nestling it by their gums, if possible. The logic being you don't know if their insulin is too high or too low, and it's essentially the lesser of 2 evils to give them a bit of sugar. If they're too low, it can save their life. If they're too high, a tiny bit more won't hurt. True. Story 65, not really a health tip, but it baffles me when people decide that pharmacy is the better place than the ER for their emergency medical needs. Over 170 systolic pressure, heavy bleeding, infection, asphyxia, etc. Story 66, maybe someone here knows the truth behind this, but my mother refuses to eat a lot if vegetables because they are genetically modified. She acts like eating this will give you cancer and make you die. It should also be noted that my mom has chronic fatigue syndrome and fibromyalgia. Is she crazy, or does she actually know what she's talking about? Story 67, faith healing. I always see these poor kids coming in with mustard and butter put on their burns, and it only seems to be a Mexican thing. Do not do this. The burn is not a hot dog or toast. Put nothing on it. Story 68, MD here, prayer. I can't prove it doesn't work, but they always pray and take the medicine surgery always, so who knows? Maybe prayer helps, huh? Well, positive state of mind does help, so I guess it does help. Story 69, I'm not a medical professional, but I'm pretty sure this is wrong. I played baseball as a kid, and somebody started bleeding due to a large cut. Their dad tried to cauterize the wound with a lighter. He didn't try to heat a piece of melt or anything. He tried to use a lighter directly on the surface of his son's skin. Story 70, nursing student here. Worked in a private nursing home. Some girl I worked with were talking during a break that they didn't believe in compressive stockings and socks, and they then proceeded to tell me they sometime didn't put it on their clients since it was too hard to install, and anyway, it was useless. I then proceeded to teach them about these compressive socks and what they do and how they work and why they need it. And one of the 2 actually said, "Oh yeah, mister, the nurse, we will do that from now on," rolled eyes and left. I was shocked. Story 71, I had a point. Just today, refuse all RX because the only thing he ever takes is pot and spice and love. This is after we called a code for him purging around his room with an open laceration to his head. Story 72, woman am I with, says she's on a gluten-free diet along with going kosher. She is not allergic to gluten, nor is she Jewish. She thinks it's healthier. Story 73, I had a great one today. Went in with a fever over 100F, dizzy, nauseous, sweating even though I was freezing. The response, you're healthy. Hey, race a doctor's note to miss work. I guess that's what I get for going to a clinic instead of a hospital. Story 74, heard someone the other day saying to their friend, yeah, if I get a burn, I just rub Vaseline on it. That's what it's made for. It keep the wetness inside. My face must have been immobile. Story 75, I was once getting a haircut, and the salon clerk was talking to a coworker saying that she noticed that when she eats breakfast in the morning, then she gets much hungrier by the time lunch comes around. And so she was going to stop eating breakfast so she wouldn't be so hungry by lunch. Story 76, I broke my foot playing football my junior year of high school. I tried to explain to my dad how I needed to get x-rays and a cast, but he insisted I go visit the Sobadora or a Mexican massage lady, and she would fix it. I don't think having some lady twist and squeeze my foot while it is broken would help. Dad still think I should have gone. Huh. Story 77, dumbest thing. I heard she was a psych patient, but when she got her lap band a few years ago, her diabetes has been cured, so she doesn't receive insulin anymore. I was a nursing student, and everybody just shook their head and didn't do a thing about it. Story 78, if you have chest pain, you can cough, and it will all go away. No. Maybe it will go away by itself, but you could also go in cardiac arrest and die. Story 79, ain't a nurse or a doctor, and this might not be directly health-related, but a girl I know used to believe that eating lots of carrots would make you bigger. Story 80, the absolute worst I have ever heard, and I am hearing it on a more frequent basis, is vaccinations make you sick. The cure for that is education, real verifiable education. But everyone with the internet thinks they know more than a doctor. Not everyone. I exaggerated for effect. Story 81, met a guy who told us his story about trying to cure his crabs with icy hot. We called him after that. He wasn't a smart man, which is probably why he's 6 feet under now. R.I.P. onions in your socks absorb toxins from your body, and that you can pee in a bucket of Drano to determine the gender of your unborn baby. Story 82, oh, you have a cold. Here have a Z-Pack, or this antibiotic and oh. I hate DRs that just give out antibiotics like they were Smarties, that and dumb people not finishing their antibiotics. Sick of having to gown up for all these MRSA, having sons of, and if you have a cold, don't come to the ER, and take up a bed, drink water, and rest. There is no cure for colds, not a professional here, but I have a big problem with natural being used as a qualifier for allegedly superior treatments. Curare, wolfbane, jellyfish stings, and cobra venom are all natural too. Story 83, the article that is doing rounds on Facebook recently. The best way to deal with a stroke is apparently to take a needle and puncture the skin on all the fingers of the person having a stroke until a couple of drops of blood show. Then you have to the ears of the person and wait for exactly 2 drops of blood to show. Do not call the ambulance, as the blood vessels in the brain will break from being shaken on the way. What pisses me off the most is that some people will actually kill their family members in this way, thinking they're doing a good deed. Story 84, I'm not a doctor or nurse, but I saw someone the other day give advice about what to do when someone is having a seizure based on what they had to do for their dog when it had a seizure. Story 85, it always annoys me when parents bring their kid into the ER with a high fever and say that the meds aren't working to bring the fever down. 90 of the time, it's one of the following 3 cases. 1, the kid actually doesn't have a fever anymore. A fever is 38.0C. People 2, they gave Tylenol. You were supposed to give Advil for fevers, not Tylenol. 3, they gave a tiny dose of Advil once. 8 hours ago, you're supposed to give a max dose. Round the clock, there's no point giving your kids subtherapeutic doses of medication because you're scared that meds are bad for them. WTF. I also hate when parents say their kids have a fever and you ask them what their temperature is and they say, oh, I don't know, we don't have a thermometer, I just use my hand. ARGGH, you have a kid, buy a thermometer, IT costs like $5, Jesus. Basically everything on Answers Health. Also, drinking lots of water as a remedy for anything, everything besides dehydration. Story 86, not a doctor, not a nurse, just an idiot. This is something I did myself. I get really bad eczema all over my body, and I have ever since I was a baby, but I have never had it on my face before. Once I ended up getting a rash on my face that looked a lot like eczema that wouldn't clear up using non-steroid creams specifically for eczema and dermatitis. I I went to the pharmacist and bought a non-prescription steroid cream. I prefer not to use steroid creams, but as a last resort before go to the doctor, and applied it to the rash maybe 2 to 3 times a day for a few days. Actually made the rash worse, so I went to the doctor. It turns out that I had a fungal infection. Yeah, I know, it's gross, and steroid cream was the worst thing that I could have put on it. The doctor didn't give me a prescription, but recommended a very mild antifungal cream. So I bought it, applied it, and within a couple days my rash was gone. It was a dumb thing to do, but in my defense, my eczema flares up so often that it just didn't occur to me that it could be something else. Story 87 never said that part was wrong. Just said the people who believe that the aspirin was the cure-all are the ones that made my head hurt. Think you're having a heart attack. Chew an aspirin and call 911. Story 88 obligatory, not a doctor comment. But a fitness enthusiast, too long to list, but basically every single offhand comment about muscular and skeletal anatomy, nutrition, and how the body responds. From the common squats, kills, knees, to the thankfully less common supplements will give you cancer, make you sick, and then kill you, slight paraphrasing, but only slight. Story 89, although I'm not a doctor or nurse, a friend accidentally hit me in the face with a hammer end of a cricket golf stick in summer camp. When I was 11, it hurt pretty bad, so the local Russian lunch ladies had a great idea of putting butter on it. Later, I had to have it cleaned out and sewed up. Oh yeah, after holding ice over it for like 40 minutes while the camp personnel were buying Skittles and other candies to sell to the other campers. Wonderful day.